Hello and welcome. And today I want us to discuss a very important topic that is the danger signs that you need to be aware about, especially for the newborn babies who have just been born. Okay. And if you're new here, please consider subscribing to our YouTube channel that is Doctor on Wheels, and also in our social media platforms that is Zawadi Premier Hospital underscore Ngong for Instagram and Zawadi Premier Hospital for our Facebook page. Now, before we start, let's start with some words of wisdom from Matthew chapter number 5, verse 16. Matthew chapter number 5, verse 16, the Bible says, "In the same way, let your light shine before others, so that they may see your good works and give glory to your Father who is in heaven." Now, let's dive into today's topic. So, number one of the danger signs that you need to be aware about is poor feeding and inability to suck. So basically, the baby will be very weak when it comes to breastfeeding, and then they just breastfeed kidogo and then they stop, okay? Or they just breastfeed just a little bit and then they stop, or their suckling is very weak, okay? Now, that one might be the only sign for to basically tell you that this baby might have been born prematurely, okay? But also the other thing that can cause poor feeding or poor suckling is infections when the baby is sick, okay? The other thing that can cause that is when the baby has been born with some certain congenital anomalies, like for example, if the baby has been born with cleft lip or cleft palate, they're not able to suckle very well. But also, if the baby maybe was born and then had what we call birth asphyxia. So basically, there was a point during the process of birth where the brain was denied oxygen. Therefore, part of the cells basically ended up dying. So then the baby is running a risk of developing some neurological problems, okay? So they will basically present with poor feeding, poor suckling, okay? Now the risk with this baby is that they can easily go into hypoglycemia because they are not able to feed, so they can easily go into hypoglycemia. And with hypoglycemia as well, they can also go into electrolyte imbalance. Now these two things, okay, can actually make the baby to deteriorate very fast, and you can easily lose that baby. So anytime your baby is not feeding well, don't hesitate, don't wait at home. Please just go rush to the hospital, get the baby assessed, okay? If it's something that can be addressed, it will be addressed and you'll be allowed to go home. But then if it's something that needs the baby to be admitted, especially with severe infections, then you will have to be admitted for baby to be assessed well and be able to be treated. Number two, danger sign that you need to be aware about is when the baby becomes very lethargic or unresponsive. Okay, so the baby sleeps almost always. Okay, they just wake up, we try to wake up the baby, but then the baby doesn't wake up so easily. Okay, or sometimes they have a very weak cry. Okay, and then if they wake up, probably they just wake up for some few hours and they go back to sleep, okay? Or you try to put them on the breast, they are not able to suck, okay? Now, lethargy and unresponsiveness is a very serious danger sign, okay? Now, that one can actually be either as a result of either the baby was born prematurely, okay, or during the process of giving birth, the baby's brain was denied some oxygen, so he ended up with some birth asphyxia, okay? So the brain is not the brain's development is not up to par, okay? Now, anytime the baby becomes very lethargic, every time the baby sleeps, you try to wake the baby up and they are not able to wake up, okay? You need to rush the baby to the hospital as soon as possible. But also, when the blood glucose level goes down, what we call hypoglycemia, okay, it can really make the baby so much sleepy and lethargic or unresponsive. So that baby needs urgent assessment by the doctor so that you're able to determine exactly what the problem is so that it's able to be addressed and um, um, so that the health of the baby is restored. Number three danger sign that you need to be aware about is convulsion. So those jerky movements or some twitching, okay, or some stiffness on one side of the body. Okay. Now, twitchy, stiffness, and convulsions can be caused by number one, if the baby has not been feeding so well, so then the baby goes into hypoglycemia. Number two is that if you have some electrolyte imbalance, so the baby is dehydrated, okay, so some electrolyte imbalance like hypocalcemia and all that, but also infections, okay, so infections such as meningitis can actually cause convulsions. So anytime the baby is having some abnormal twitching movements, okay, it's good for you to be able to take the baby to the hospital for assessment so that you are reassured. Sometimes there are just sometimes you can have some normal twitchy movements, okay, that you just need to, but then as a mother, it might be difficult for you to be able to understand which is normal and which is abnormal. So just go to the hospital, let the baby get the baby assessed, and then they will be able to advise you accordingly. Okay, so the fourth danger sign that you need to be aware about is abnormal or difficult in breathing or fast breathing. Okay, and that one can the baby can present with some form of grunting. So there is some sound that is coming. Okay, when they try to breathe. Okay, they can come with like head nodding. Every time they breathe, they have to nod the head. Okay, or they can come with they can actually have like flaring of the nurse, the ally nurses. So when they breathe, okay, the nostril, okay, has to bulge in and out to be able to allow for more air. Okay, now or when you expose the baby, you realize that there is indrawing of the intercostal muscles, okay, when the baby is trying to breathe. Now, for neonates, they have some level of subcostal indrawing, or what we call the abdominal breathing. Okay, so it is normal for especially neonates to have some form of abdominal breathing, which can be mistaken by subcostal indrawing. Now, if you are not very experienced, especially with that, you might think that it's normal, and then so anytime the baby has any of those signs, just get the baby to the hospital, get the baby assessed. If it is the normal breathing, you will be reassured, and then you can be released at home. Okay, but difficulty in breathing, you need to be aware about that because infections can cause difficulty in breathing. Okay, if maybe the baby actually aspirated meconium during the process of birth, it can cause difficulty in breathing. Premature babies will also have difficulties in breathing. Okay, so and then babies who have had difficulties, especially during the birth, or especially the babies who have had birth asphyxias, they will also have some several level of difficulty in breathing. So you need that to get that baby assessed so that we're able to know exactly what we are dealing with and what will be the main cause of this difficulty in breathing. Because with that, the baby can easily deteriorate, and you might end up losing that baby. Now, the other thing that you need to be aware about is hypothermia. So hypothermia is when the temperatures goes extremely down, probably below 35 degrees centigrade. So the baby will feel abnormally cold. So you try to touch the baby, especially on the hands and on the feet, they are abnormally cold. Okay, and now that one is very much prone to especially babies who have been prematurely born. Okay, so premature babies, but also babies who end up with glycemia, where the blood sugar level goes down. They can also become very they can become hypothermic, okay? But also infections. Infections can either spike your fever, so you end up having with fevers, or you end up having hypothermia. So abnormally cold or abnormally hot. So temperature below 36, abnormally cold, and temperature above 37.5, abnormally hot. Okay, they need to get the baby to be assessed, because that might be the sign of infection, okay, or the blood glucose level has gone down, so you need urgent assessment. Now, the other danger sign that you need to be aware about is jaundice. Now, jaundice is a yellowish discoloration of the mucous membrane, okay, or even the skin. So, for babies, when the skin is still very visible, you can actually see yellowish discoloration around or just below the skin. But the main area where you can see that yellowish is around the sclera. Okay, so the whitish part of the eyes. Okay, now we have what we call physiological jaundice and pathological jaundice. So physiological jaundice is that normal jaundice where around 80% of babies who will be born, they will have jaundice. Now, pathological jaundice basically is what we call, or in other words, abnormal jaundice takes place within the first 24 hours. Okay, so if your baby starts to turn yellow the first 24 hours after birth, that is an abnormal, or what we call physiological jaundice. And what can cause physiological jaundice? Number one is infection, top of the list. Okay. Number two is when the baby has abnormal breakdown of the red blood cells, okay, a condition called hemolytic disease of the newborn. So the baby, it's a condition where there is abnormal breakdown of the red blood cells, so a lot of bilirubin is released, and then the body is not able to get it out, and therefore it settles in your mucous membrane, the eyes. Okay. Now, and then the physiological jaundice basically it's after 24 hours. Okay, so from 24 hours and above, most of the time it's physiological jaundice. Okay, now with physiological jaundice, or basically with jaundice, you need the baby to be assessed so that you are able to be told this one is something that can even be managed at home, or this baby will need to be admitted. Because with excessive jaundice, okay, that that bilirubin, or that jaundice can actually get into the brain, okay, that bilirubin in a condition called kernicterus. Now, that bilirubin, okay, it's very toxic to the brain, and it can actually damage the brain, okay, and then you end up with a baby who will grow with some brain abnormalities like cerebral palsy. So anytime the baby starts to turn yellow, okay, please take the baby to the hospital. Let the baby get assessed so that you're able to be reassured that everything is okay. Okay. The other thing that you need to be aware about is when the baby starts to have abnormal vomiting and abnormal abdominal distension. So persistent vomiting and abdominal distension, okay, that one might be a sign that the baby might be having intestinal obstruction, but also it might be a sign of an infection called necrotizing enterocolitis, which is an infection that is much more prone to babies who have been born preterm. So anytime the baby has this persistent vomiting, every now the baby is vomiting, they're not able to retain anything, the abdomen is distended and all that, you need to get the baby to the hospital as soon as possible so that the baby is able to be assessed. Okay, with infection, the baby will have to be admitted, given IV fluids and antibiotics and all that. Okay, but with abdominal distension, okay, once the baby starts to have abdominal distension and persistent vomiting, you need to first of all stop breastfeeding as we rush the baby to the hospital. The other thing that you need to be aware about, probably last but not least, okay, that you need to be aware about is some abnormal bleeding. So, bleeding either from the umbilical stump or bleeding from the skin, bleeding from anywhere around the mucous membrane, from the mouth and anywhere. When the baby starts to have some abnormal bleeding from trivial scratches and all that, that one might be a sign of vitamin K deficiency. And that's why babies, after they have been born, okay, there's a shot of vitamin K that they are normally given to try and help to stop bleeding, because they are prone to bleeding immediately after they are born. Okay. But also it can mean that they might be having some issues with coagulation, so they are not able to clot the blood, like some coagulation abnormalities. It might also be a sign of an infection. So those by far are the major danger signs that you need to be aware about, that when they happen to your baby, please, you need to rush that baby to the hospital as soon as possible for assessment, so that severe conditions and infections are able to be captured early, so that they're able to be addressed and the baby is saved. Now, if this content has been helpful to you, or you find this content very useful, please consider subscribing to our YouTube channel, Dr. on Wheels, and also turn on the notification button so that you are able to be notified every time we upload a new video. And you can also visit us at our hospital. We are located at Loopsil Center, opposite Juanco petrol station, and we will be able to attend to you very well. Until next time, God bless you.